Sleep apnea is more common and more dangerous than most people realize. From constant fatigue to serious health risks, it can silently affect your life without you knowing it. Today, we're breaking down what sleep apnea really is, key warning signs, and when to get help. Like this video and subscribe for more health info that could truly change lives. Let's get into it. 1. What is sleep apnea and how does it affect your health? Sleep apnea is a serious medical condition that disrupts breathing while you sleep. It occurs when the airway becomes partially or completely blocked, leading to temporary pauses in breathing. These interruptions in breathing can last for a few seconds or even minutes and often occur many times throughout the night. As a result, the body is deprived of essential oxygen, and the brain sends signals to wake up and resume breathing. This disrupts the natural sleep cycle and prevents the body from achieving restorative deep sleep. Sleep apnea can lead to daytime fatigue, irritability, and difficulty concentrating, making it harder to function normally. 2. Common signs and symptoms of sleep apnea. Recognizing the symptoms of sleep apnea is essential for early intervention, but many individuals do not realize they are experiencing these issues. Loud snoring is one of the most common signs, but not everyone who snores has sleep apnea. Episodes of choking or gasping for air during sleep are other indicators, often noticed by a bed partner. Individuals with sleep apnea may experience excessive daytime sleepiness, which can lead to falling asleep at inappropriate times, such as while driving or during meetings. Morning headaches, dry mouth, and a sore throat upon waking are also common complaints among those suffering from sleep apnea. In some cases, people may experience difficulty concentrating, memory problems, or mood swings, which can impact both work and relationships. 3. Risk factors for developing sleep apnea. Several risk factors can increase the likelihood of developing sleep apnea, although it can affect anyone, regardless of age or gender. Obesity is one of the most significant risk factors, as excess fat around the neck can obstruct the airway, leading to breathing difficulties during sleep. A family history of sleep apnea also increases the chances of developing the condition, suggesting a genetic predisposition. Age is another factor, as sleep apnea becomes more common with age, particularly in those over 40. Men are more likely to develop sleep apnea than women, although the risk for women increases after menopause. Certain anatomical features, such as enlarged tonsils, a thick neck, or a narrow airway, can also contribute to sleep apnea. 4. The different types of sleep apnea. There are 3 primary types of sleep apnea, each with different causes and treatment approaches. The most common type is obstructive sleep apnea, which occurs when the muscles in the back of the throat relax excessively during sleep, causing a temporary blockage of the upper airway. Central sleep apnea, although less common, happens when the brain fails to send proper signals to the muscles that control breathing. Unlike obstructive sleep apnea, central sleep apnea does not involve a physical blockage, but rather a failure in the respiratory control system. The third type, complex sleep apnea, combines elements of both obstructive and central sleep apnea, making it the most challenging to treat. Each type of sleep apnea requires a specific treatment approach, and the severity of the condition can vary greatly between individuals. 5. How sleep apnea affects your mental health. Sleep apnea does not only affect physical health, but can also have significant consequences on mental health. The constant disruption of sleep cycles caused by sleep apnea leads to inadequate rest, which can contribute to mood disorders such as depression and anxiety. Chronic fatigue resulting from poor quality sleep often leaves individuals feeling irritable, stressed, and emotionally drained. The lack of restorative sleep affects cognitive functions such as memory, attention, and concentration, making it harder to perform daily tasks and maintain productivity. In severe cases, untreated sleep apnea can lead to cognitive decline, confusion, and difficulty processing information. The sleep deprivation caused by sleep apnea may also lead to a weakened immune system, making it more difficult to cope with stress and emotional challenges. Furthermore, the symptoms of sleep apnea, such as excessive daytime sleepiness and difficulty staying awake, can contribute to feelings of frustration and helplessness. 6. The connection between sleep apnea and cardiovascular health. Untreated sleep apnea is strongly linked to a number of cardiovascular problems, including high blood pressure, heart disease, and stroke. During sleep apnea episodes, the body experiences frequent drops in oxygen levels, causing an increase in blood pressure and stress on the heart. These repeated oxygen fluctuations can lead to hypertension, which, if left untreated, can damage blood vessels and increase the risk of heart attack and stroke. Additionally, sleep apnea can contribute to arrhythmias, which are abnormal heart rhythms that can be dangerous, especially in individuals with existing heart conditions. The strain placed on the cardiovascular system during episodes of sleep apnea can exacerbate pre-existing heart disease, making it harder for the body to recover and function properly. Even mild sleep apnea can increase the risk of heart-related issues, and the longer it remains untreated, the greater the chance of developing serious cardiovascular complications. 7. The role of continuous positive airway pressure machines in managing sleep apnea. Continuous positive airway pressure machines are the most common and effective treatment for obstructive sleep apnea. These devices work by delivering a constant stream of air through a mask that keeps the airway open during sleep. The air pressure helps prevent the collapse of the upper airway, which is the main cause of the breathing pauses seen in sleep apnea. Continuous positive airway pressure therapy is often recommended for individuals with moderate to severe obstructive sleep apnea, especially those who experience frequent interruptions in their breathing. Although the continuous positive airway pressure machine is highly effective in treating sleep apnea, it does require some adjustment and consistency for optimal results. Many people initially find it uncomfortable to sleep with the mask, but over time, most individuals get used to it. 8. Lifestyle changes that can help manage sleep apnea. In addition to medical treatments, certain lifestyle changes can significantly improve the symptoms of sleep apnea. Weight loss is one of the most effective ways to reduce the severity of obstructive sleep apnea, as excess weight, particularly around the neck, can contribute to airway blockage. Eating a healthy diet and engaging in regular physical activity can help individuals achieve and maintain a healthy weight, which can reduce the frequency of sleep apnea episodes. Avoiding alcohol, sedatives, and smoking is also essential, as these substances relax the muscles in the throat, making airway collapse more likely. Smoking, in particular, can increase inflammation and fluid retention in the upper airway, making breathing more difficult. Positioning during sleep can also make a difference. Sleeping on one side may help prevent the airway from becoming obstructed. 9. The importance of early diagnosis and treatment. Early diagnosis and treatment of sleep apnea are critical in preventing long-term health complications. The earlier the condition is identified, the sooner it can be managed, reducing the risk of developing serious conditions such as heart disease, stroke, or diabetes. Unfortunately, many individuals with sleep apnea remain undiagnosed for years because the symptoms often occur during sleep and may not be noticed by the individual. Seeking medical advice if any symptoms of sleep apnea are recognized is important in obtaining an accurate diagnosis. Healthcare providers may recommend a sleep study, either at a sleep center or through a home test, to monitor breathing patterns during sleep. This can help confirm whether sleep apnea is present and determine the severity of the condition. Once diagnosed, a variety of treatment options can be explored, including continuous positive airway pressure therapy, oral appliances, or surgery, depending on the type and severity of the sleep apnea. 10. The impact of untreated sleep apnea on quality of life. Untreated sleep apnea can have a profound impact on a person's quality of life. The constant interruptions in sleep prevent individuals from reaching the deeper stages of restorative sleep, leading to chronic fatigue and reduced daytime alertness. This can affect performance at work or school, impair cognitive function, and increase the risk of accidents due to drowsiness. The emotional and mental strain of living with untreated sleep apnea can lead to depression, anxiety, and irritability. Social relationships may suffer as well, as the individual may feel isolated or embarrassed about their condition. The long-term effects of untreated sleep apnea, such as cardiovascular problems and high blood pressure, can reduce overall life expectancy and increase the risk of developing serious health issues. Ignoring sleep apnea can lead to long-term health problems, but awareness is the first step. Do any of these symptoms sound familiar? Share your thoughts in the comments. And if this video helped you understand the risks and realities of sleep apnea, hit that like button and subscribe for more essential health insights. Your well-being starts with better sleep.